Hello everyone, welcome to my channel Study Nursing by Sense Course. Today in this video, we are going to learn about nursing care plan of self-harm or self-destructive violence. This care plan could be used as a risk of self-harm or self-destructive violence or a potential or a an existing problem. So you could consider both these things. And I have also designed this care plan considering a patient who has an existing mental health disorder, which is depression or anxiety, maybe. As we all know, that an individual can self harm because of so many factors. Including their particular age, such as in teenage, or including a particular community riot or something. There could be as many possible reasons as one can think of, but I have kept in mind anxiety or depression, and with that I have designed the care plan. I have also made sure that I have given two scenarios so that you get an idea of how to design it or how to implement it in a more individualized way. All right, that being said, let's jump onto the nursing diagnosis. It says risk for self harm or self directed violence. You can always add as evidenced by and your observation. It's up to you. Next, we go to the subjective data. In subjective data, you may or may not have it, but I have, I was saying, I have given a scenario sample, and I've given a subjective data in case you wish to refer. Since it's a case of anxiety or depression, when somebody commits a self harm, they may or may not have the mind of telling that to you. So it's important that you do not force that patient just to get your subjective data. You can consider it as present or not, and you can always mention if you're preparing a care plan and submitting it to your tutors. You can always mention that because of my patient feeling depressed or not feeling like opening up, I do not have the data. Yes, and that being said, let's move to the objective data. I've put a couple of observations that as a nurse we can make, but it's always up to you to individualize your nursing care plan and have a closer look at what all things you can observe in the patient. So if the patient comes to you and you know that they have committed the self harm, you can look for their appearance, how they are appearing like, and look for any bruises or any active bleeding, any notable behaviors you can observe in them, any particular event that triggered the self harm, any of the with the physiological changes. What I was saying was any edema, swelling, or any of the things that you can observe in the patient. And most importantly, environment. It's very important that they have a calm and comfortable environment because they have already committed something. They're in mental turmoil, and a clumsy environment or an unsafe environment would trigger further injuries to the patient. All right, so these are the rationale for the observations that you make. What would be your goal? It should not always be like my patient do not commit further self harm in the future, because you cannot say that as a nurse, because there are always mental health related factors involved. It will depend on a lot of factors, and a nursing care plan we are discussing is of short term. So make it a simple and realistic plan, that the goal should be something like my patient remains safe during my shift. So that would be as simple as one can think of. And that being said, let's jump on to the assessment. In the assessment, in the nursing assessment, you would identify what exactly caused or triggered this event, and you can always help the you can always take the help of mental health experts to assess the level of anxiety or depression or the self harm, and make sure that you're recording it so that you kind of have the idea. All right, this patient has mild or moderate or extreme chances of self harm. Based on the assessment, you can derive those conclusion. All right, and identify the kind of precautions which is needed. So when I say this, what I mean is based on the level of anxiety or depression or aggression the patient is on. You need to take appropriate precautions. All right. What all would be monitoring compressing of? So in monitoring, as a nurse, when you have a patient with self-harm, it's important that you observe his vital signs, his or her vital signs, behavior, and his surroundings, and also the visitors, because sometimes their presence or absence can have an impact. All right. um, don't worry, I will be explaining this in detail in the upcoming slides. I've put across a scenario, so I'll be able to explain these points in details. But just consider this as some of the points in the monitoring section. All right. This is once again a couple of points that I've put across, but feel free to take up these points or expand or add or individualize these points based on your patient's condition or scenario. So I would encourage that patient to express his feelings and emotions that could have a relieving effect on my patient. I would also support him or her in establishing a plan. We all know as nurses, when a patient participates in his care, that's when the care becomes so much complete and so much fruitful. So give as much support as we can. It's also important that if the patient has an existing problem or an existing self-harm, we recommend a crisis counseling. It's a type of counseling that somebody can have in case of a existing crisis happens in them. And at the same time, there are also a couple of points such as uh, providing or encouraging the family to support this patient, and also to refer them and give as much as information regarding the self-help group or anonymous group or community group that they might want to join. And at the time of discharge, to make sure that the follow-up is made appropriately. All right, so these are the couple of nursing interventions that you can include in your nursing care plan. Going on to this outcome, as a result of my interventions, my patient remained safe and comfortable during this shift. Um, yeah, so I think it's time for me to share the scenario with you. I hope you have understood whatsoever points that we discussed so far. If you haven't, please feel free to watch the video a couple of times so that you get a design in your mind, a mind map of how your care plan would look like and how it is to be designed. I'm giving you a scenario. A 35-year-old male named Alan got admitted to the emergency with bruises over his face and head as a result of self harm. In my assessment, I go to Mr. Allen. I introduce my role and the reason why I am there. And or in a conversation, I elicited or I got the subjective data, which says I became restless after my dinner and had strong thought to kill myself, and I started banging on the wall. So this is what Alan is telling me when I approached him and I had a conversation. Um, as a nurse, I would observe the following things, and on observation, just as a dummy scenario, I'm telling. I found out, I discovered Alan had elevated vital signs. When I say that, I found out Alan had high blood pressure, high heart rate, elevated temperature. He is having active bleeding, and his bruises are looking bad. It may or may not need some stitches. Alan tends to be restless and he seems so tired, and I identify him as like chances of having a risk of falling. All right. Um, these are my objective data, and I would now design nursing interventions. So my nursing intervention would be before that, I've already discussed the goal of my patient, so I'm not gonna say that again here. So I've got a nursing diagnosis in place, which I already discussed before. I've also got an outcome in place, which is my patient remains safe during my shift. All right. So that being said, I'm showing this nursing interventions here. As you all see that. I've told you Alan has a couple of elevated vital signs. So I'll make sure as a nurse to monitor it very closely depending on the severity. So if it is like profused, elevation or dip in the blood pressure, I would check the vital signs every 15 minutes. And I would also assist my medical team in any of the procedures needed, for instance, with the stitching or doing a dressing on my patient, or assisting in preparing Alan for X-ray or CT scan. So that's what I mean by the second point. A third, once I made sure that Alan is stable physiologically, we have ensured that the bleeding stopped, he is comfortable, have provided cold pack or whatever compress which is required, have provided comfortable position, everything is done, then I would provide I would encourage him to express the feelings if that is applicable in the condition. And it's also important that we explore Alan's choices, because as a young adult, in case we find out that he has otherwise normal findings, we can always check with Alan what his preference is, whether he wishes to go home or whether he wishes to stay in the hospital for further observation. All right. And as I've told previously, I would also liaise with the multidisciplinary team that includes mental health experts or even psychiatrists, and also transfer Alan to ward or room based on the scenario. And as important as it is, a discharge referrals to the mental health team or counseling or the support group, etc., based on your country's policies or based on your organization's policy, or even your what your school is teaching you. All right. So this is what the nursing interventions would look like. But I have also added one more set of interventions in case you are a nurse working in the ward or any other setting. All right. So in this, I have encapsulated the interventions into four. One is to initiate treatment and ensure Alan is otherwise stabilized, and ensure that the medications are in place. It's very important, especially when they have depression or anxiety, and when they are on the bipolar medication, or they have never been into any medications, but the psychiatrists have decided to start the medication. So this is very important point. And this is because the pharmacological measures might be critical in this case, so as to prevent further harm, or self-harm, or even harm to the community. You know what I mean? So these are the couple of points that I've provided for the nurses working in the ward or any community setting. Family support and counseling, we have already discussed about it, but I thought to share with you additional or complementary interventions if you are somebody working in the setting other than emergency. All right. As a result of my interventions, as a result of my, assessment, formulation of nursing diagnosis, formulation of my goals, and a couple of actions I did as a nurse, I had the outcome that states Alan remained safe and comfortable, as evidenced by verbalization. You can add what Alan said to you, or a particular event. So as a result of these interventions, he got transferred to this place where he will be getting this support. All right. So this is what a nursing care plan of self harm or self inflicted violence would look like. I hope you have had an idea of it. If you had, make sure you subscribe to my channel. I really want to thank you all for your time, and all the very best for your career to become a nursing professional with more confidence. All right. Thank you.